Hello, good afternoon. Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Welcome to our weekend open clinic. Today, I'm going to look at different pregnancy myths and we're going to try and set the record straight. So, what are those different fairy tales, myths? Do this, do that, don't do this, don't do that in your pregnancy. That's what we're going to talk about today. The state of pregnancy brings a lot of joy and excitement. And along with this excitement comes with so many things. So many people will tell you to do this, so many people will tell you to do that. And if you're not careful, most times you end up putting your life and the life of your baby in danger. So, what I intend to do today is to look at a couple of popular pregnancy myths and look at it from a perspective of facts. So we're looking at facts versus pregnancy myth. And I'm going to start. Once you come in, announce your name, announce your location. Once I'm done with my presentation, you have opportunity to ask your questions. This particular clinic is very important to all pregnant women. If you're in your first trimester, second trimester, third trimester, I need you to pay attention because there are a couple of things that will help you in this pregnancy. Now, pregnancy is a journey. It's not a destination. The whole 42 weeks you will be pregnant, anything can happen. Now, besides going for your regular routine A and C, you have to be very conversant with expectations. You have to be very conversant with the normal so that if something happens abnormally, you can get help immediately. Now, let's start with a couple of myths out there. The first one is eating for two. So I'm sure your mother, your friend, your grandmother, and all the people that have had their babies, if you notice, the biggest advisors we have in life are people that think they have gone through something. But guess what? No two pregnancies can be the same. Even if you had 4 babies, your 4 babies had individual different pregnancy experience. So your mother's experience is not your experience. Your sister's experience is not your experience. Your friend's pregnancy experience is not your experience. Now, eating for two, it's a big myth. You are not supposed to eat extra because you have a baby. You are supposed to eat healthy food and gulp exactly the calorie you need. The calorie you need and the quantity of food you need is based on your individual constitutional factors. There are some healthy weight you are supposed to add when you are pregnant so that you can be in a better position to birth your baby. You are not supposed to eat extra. So the concept of, oh, don't you know I'm pregnant so I can have my ice cream, so I can have my cake because I'm carrying a baby, it's what we call dead on arrival. There is no merit. It's a myth. It's not factual. Matter of fact, by the time you're eating more than you need, you will complicate your pregnancy. Some women might predispose themselves to pregnancy complications, including preeclampsia, including pregnancy-induced diabetes, including gestational diabetes. You don't need to complicate your pregnancy. If you add excessive body weight based on the fact that you're not eating the right kind of things, you are putting your life in danger and you're putting the life of your baby in danger. So eat clean. The exact food you need when you go for your ANC, the exact body weight you need to add, you should add them. Don't exceed your calories. Don't eat more than you should. Don't eat for two. That's the simple explanation for that myth. Now, the second myth is about alcohol. You see, depending on where you're coming from, they will tell you, oh, it's okay. You can drink little quantity. You can drink Zobo. You can drink stout. You can drink palm wine. Guess what? No level of alcohol is recommended in the whole 3 trimesters. None in first trimester, none in second trimester, none in third trimester. Alcohol completely, it's not recommended in pregnancy. It's a no-no. There is no safe level of alcohol. Matter of fact, in general health, until proven otherwise, alcohol do not have any health benefits. How much more when you are drinking it in your pregnancy? not just in your pregnancy, during breastfeeding. Remember, there are so many things you might be consuming that might be alcoholic, that you will not know is alcoholic because you're looking at beer, you're looking at shinap and all that. If you are drinking palm wine is alcohol. You don't need palm wine. You don't need it when you're pregnant. You don't need it when you have your baby. You don't need it when you're breastfeeding. It's alcohol. It's not going to help you. It's not going to help your baby. Matter of fact, some women that drink during pregnancy might end up having baby that will have fetal alcohol syndrome. Fetal alcohol syndrome has different spectrum. Your baby's brain can be damaged, your baby's developmental milestone can be damaged, and your babies can actually be born with physical presentation of alcoholism. You don't need it. Some babies might be born small, some babies might be born with deformities simply because during pregnancy, the mother was still drinking stout, the mother was drinking palm wine, the mother was drinking Zobo. Now, until proven otherwise, please categorize your Zobo in the same position with alcohol. We are still trying to do a lot of research, but we are not clear if Zobo is allowed or not allowed. Zobo is a popular drink, a drink from hibiscus, flower they drink in Nigeria. Please also avoid Zobo. Avoid your Zobo, avoid your alcohol, avoid your palm wine, avoid your stout. Unfortunately, there are some women that even if I tell them the right things, they will still go ahead and do the wrong things. One particular woman told me, but I took stout during my pregnancy for all my 4 babies. I was taking stout and all that. She ended up damaging her liver. So be careful. Avoid alcohol completely. Now, another myth. Some people believe that, once you're pregnant, you're not supposed to exercise. You're supposed to just be eating food and you don't go for exercise. Guess what? It's a myth. You are supposed to engage in mild and moderate exercise during pregnancy. There are so many health benefits when you stay active. So whether you're pregnant, whether you're having your baby tomorrow, you still need to move. Sitting is the new smoking. So together with eating right, definitely not drinking alcohol, definitely not believing all the stuff they've told you. You have to be very, very meticulous about this. You have to move. But make sure you're moving, make sure your exercise, it's moderate. So you can go for a walk, you can go for a little jog, you can go for a little swimming. So don't go overboard. The type of exercise we do not recommend in pregnancy is extreme exercise. Exercise that can affect your pelvic region, your abdominal region, differently. But you can go for walk. You can go for swimming. You can go for little jogging. You can go to gym and do one of few little aerobics. That's okay. But please, by any means necessary, you have to move. Exercise is very important. In your pregnancy, when you're exercising, you're training your body, you're training your pelvis, you're keeping your blood sugar within normal level, you're keeping your blood pressure within normal level, you're improving your sleep, because when you exercise, you release those endorphins, those feel-good hormones. So anytime you're sweating, you're actually burning calories, you're putting yourself in the right place. Now, another myth in pregnancy, it's as regards how big your belly is, the position of your belly. So some school of thought believe, if your belly is tilting towards the right, or if your pregnancy is high, or if your belly is high, or if your belly is low, you're going to have a baby boy or going to have a baby girl. Guess what? It doesn't make sense. There is no truth in it. It's a complete myth. Whether your belly is big, whether your belly is small, whether it's high, whether it's low, what you will have, you will have. The determining factor of what you will have is the X chromosome. If your husband or your male partner gives you Y chromosome, you're going to have a baby boy. If your husband gives you X chromosome, you're going to have a baby girl. So position of your pregnancy, how big your pregnancy is, how big your belly is, do not have anything to do with gender reveal. What you will have, you will have. There is no association between what you will have and how your baby will look. Now, another myth is the concept of, when you have stretch marks, when you use cocoa butter, it's going to remove the stretch marks. Also, that on arrival, there is no merit in such, okay? Just know that when you have stretch marks, what's going on in stretch marks? When your pregnant belly is developing, it's going to put a lot of strain on the skin. When the skin stretches, they can respond with stretch marks. It's called stria gravidarum, the least of your problem. Look, you have to trade off something to get something. The least of your problem in pregnancy is whether your belly is big, whether you have stretch marks or not. I don't care. I don't care if you have all the stretch marks in the world. You have a baby. You've paid the price. The biggest thing you are looking for, you have. So stop believing all the stuff they told you out there and whatever. Okay? Now, another myth is the concept that, oh, once you're pregnant, you're not supposed to make love. It's not true. You can make love from today till the day you go into labor, so long as there is no complications, so long as previously you didn't have any complications, so long as you didn't have recurrent miscarriages, recurrent stillbirth, so long as you were not bleeding, so long as water is not coming out of your body, and your doctor did not tell you to not make love. You can make love. Some people believe that, oh, when the partner makes love and he pours the semen or the penis, it's going to get to the baby. Completely not true. Your baby is comfortably developing in your womb, completely cordoned off from the whole environment, in the amniotic sac, where the baby has amniotic fluid developing properly. So please make love. Matter of fact, when you become pregnant and you engage in lovemaking with your partner, it's going to give you a lot of good benefits. It's going to create a lot of good bond. It's going to release endorphins. You know, sometimes pregnancy can be very discomforting, but when your partner is there caring for you, you know, lovemaking is a very sweet experience. So it can play a lot of role in calming you down. So please go make love, so long as there is no contraindication in lovemaking. Some women will be asked to abstain from lovemaking. Now listen to me carefully. Anytime in your pregnancy you notice blood, spotting, little spotting, you went to wipe and you saw tiny bleeding, suspend the 3 S's I'm going to mention. No sex, no spots, and no stress. 3 S's. Sex, spots, stress. Because any form of bleeding in pregnancy is abnormal. We have to rule out implantation bleeding or bleeding due to threatened abortion or threatened miscarriage. But please report all forms of bleeding to your doctor. The only time we can tell you not to make love is when we are worried that lovemaking might aggravate or be a risk factor to poor outcome in your pregnancy. But if that's not the situation, make love as you want. Completely okay. Now, another myth is, so don't worry, you can sleep on any part of your belly during pregnancy. It's not true. You are advised to sleep on the left side of your belly, on your body, not belly. You are not supposed to sleep on your belly at all. And you are not supposed to sleep on your back, especially your back. When you are sleeping on your back, the pregnant belly can depress a major vessel that helps you in distributing blood, and you can have problems. Definitely, you should know this by now. You're not supposed to sleep on your belly because that's where you have the whole load in your body. So sleep position is very important. Make conscious effort to sleep on the left. The left side is the recommended side to sleep. If you alternate sleeping from the right, somehow I can forgive you because it's difficult, but make conscious effort to sleep on the left. The left is the recommended position to sleep during pregnancy, not your back, not your belly. Please avoid them. Don't do that. So those are the few myths I could remember right now. So probably by the time I start taking questions, you can ask all your questions. But so please don't eat for 2. Exercise, no alcohol, sleep on the left. Okay? Cocoa butter, if cocoa butter is your preferred cream, use it, but it's not going to do anything to your stretch marks. Okay? Your stretch marks are completely okay. All right? So I'm going to open the clinic now, and I want you to ask your questions. Please ask your simple, straightforward questions. I'll give you a feedback in real time. If today is the first day of attending my clinic in YouTube, thank you so much. My name is Dr. Chudi Ufundu. I'm the convener of Open Clinic with Dr. Chudi on YouTube. Check us out on Snowspirations Health. Please subscribe. Now for today, if you want a personal relationship, If you want an exclusive opportunity, we have a special community in YouTube. So you can go to that join option, click on it, then you decide how you want to meet me. So I can meet you halfway. So there are exclusive channel community. We can all come together. Then I can meet you halfway and you have a lot of perks. So check it in the comment section and join if you want a personal relationship with you so I can attend to you exclusively. But besides that, please remember to subscribe. Tell everyone you love about our community. Check our various social media groups. We are in Instagram, we are in Facebook, we are in TikTok, we are in Twitter. We have our website, so check them out. There are so many educative videos in our channel that will help you to learn your body better. But right now, I'm ready to take care of your questions. Please start asking your questions so I can provide you feedback. My admin is in full attendance, so I have a full house. So any moment from now, they will start asking their own questions. Remember, every Saturday about this time, I come live. I spend about 30 minutes and I touch on topics that matter. So let's start taking care of your questions. When you talk about clean eating, what's your advice to pregnant mothers craving unhealthy food? Now, pregnancy is a state that can change from 360 to 360. There are so many things that might not be nutritious you'll be craving for. Some women will be craving for ice, some women will be craving for clay, some women will be craving for things that won't even make sense to them. It's your hormones. They are playing tricks on you. Be careful, avoid them. Anything that will take away the nutrients you need from your pregnancy, avoid them. So this is where you need to activate your willpower. You'll have to eat clean. So what do I mean by eating clean? Make sure you have your fruits. Make sure you have your vegetables. Make sure you drink a lot of water. Make sure you watch the portion of food you eat. Don't eat any raw food. Wash your food appropriately. So avoid them. You will have food you are craving for. You will crave for things that don't make sense. This is where maturity will come in. Remember the impact of whatever food you're gonna eat on your baby. As a mother, you have to think about the impact of any decision you are taking on your baby. So when the situation to drink Zobo comes, when the situation to drink alcohol comes, when the situation to drink a lot of coffee comes, think about how is it gonna affect my baby. Once you can think in that direction, then you will be mindful, because guess what? 42 weeks goes so fast. Pregnancy runs so fast. Blink and you're in labor. So avoid all forms of craving. Those things you crave for, if they are not nutritious, if they are not going to help you, avoid them. I love that question. Okay, my COO, you heard that some of our Nigerian foods can cause miscarriage or premature labor. Guess what? The answer is true. There are some natural products, there are some natural food condiments that are called abortifacient. They can induce abortion, they can induce miscarriage. Remember, whatever drug we are using right now is all coming from herbs, but they were refined, they were valued, they were investigated, they were researched upon, and we put them into different forms: syrup, capsules, IV fluids, and all that. So there are some natural hormone containing food items, containing food that can elicit labor, that can elicit you losing your baby. So the answer is true. This is why you are not supposed to take any herbs. There are so many poisonous herbs out there. There are so many poisonous foods out there. There are so many poisonous animal source of protein out there. So anything your doctor did not recommend, don't take them. I love that question. Does baby bump imply a healthy baby? No. Now, women are structured differently. There are some women that have deep-seated pelvis. You can be carrying a big baby and your bump will be tiny. And some women can be carrying a tiny baby and they will have big bump. What's the common thing you should look out for? When you go for your ANC, we use our rubrics to check the developmental milestone of your baby. Okay, so anytime you go for ANC, we check your body weight, we check your height, we make sure that your vital signs are within good. Then we do ultrasound. When we are doing our ultrasound, we're just looking at the baby. So some women carry baby differently. If you notice, if you're a mother, if you notice, there are some pregnancies you will have very big baby. Then when your baby comes out, it's just moderately okay baby. Then there are some moments you don't have a very big pronounced bump, and when the baby comes out, very big baby. So each baby is unique. Each baby will become what the baby will become based on the material that the two parents gave and based on the health of the mother. So it doesn't predict how big your baby is going to be. Okay? When is the right time to do a pregnancy test? 7 days beyond your missed period. So today is the 30th. If you were expecting your period today and you haven't seen it, please don't run to the pharmacy tomorrow. Allow 7 days. Do you know why it's good to allow 7 days? So that if you are pregnant, you're pregnant. Some women will start checking too early and they create a lot of anxiety. And anxiety is not good for getting pregnant. You don't need any anxiety. So if you miss your period, allow yourself 7 days. Once you get the urine pregnancy test positive, go and schedule for the blood test. Once you get the blood test positive, go and schedule for ultrasound. You have to have your ultrasound. Ultrasound is the clinical evidence that you are pregnant. Don't just stop at urine test. So 7 days, 1 week after your missed period, that's the right time to go for pregnancy test. Does eating spicy food induce labor? No. Any safe, edible condiments or food will not lead to labor. But there are some plants that can induce labor because they contain things that can lead to labor. But all your edible foods will not lead to labor, whether they are spiced or not. The only problem with eating spicy food is to be careful, because if you notice, someone like me, anytime I love eating spicy food, I love eating pepperish food, right? So but the problem is this. Anytime I eat any food that is very hot, just give me 1 second. I will start sweating from my scalp like Christmas goat. That's the only issue I have with eating pepperish food. But I can eat anything I want to eat. So long as what you're eating, it's properly prepared and it's edible, go ahead and do it. There is no connection between that and labor. Why are women asked to sleep mostly on the left side? Because there are different circulatory processes in the body. There are different vessels that help you to carry out blood to your baby, to the parts of the body. When you sleep on your left side, you have a better circulation. You have a better perfusion. You have a better way of the blood in your body being distributed and playing their role. It's all because of the major vessels in the body. So the left side will give you better organized pregnancy with good outcome. The left side. Worst case scenario, somehow I can pardon you if you happen to see yourself on the right side, but never sleep on your back, especially in your 3rd trimester, because when you sleep on your back, you will feel more like you are drowning in your own blood. Definitely don't sleep on your belly. You should know that by now. Okay, what are the symptoms of having a baby boy? There is no such thing, my sister. It's all myth. There is no symptom that will tell you you're having a baby boy or a baby girl. The only way to know if you're having a baby boy or a baby girl is to go for your anomaly scan about the 18 to 20 week. Now, if you live in the countries that are developed, from day one, we can take a blood sample and we can tell you if you're going to have a baby boy or a baby girl. But there is no such thing like baby boy, baby girl symptoms. Completely myth. It doesn't make sense, okay? In your 1st trimester, does it matter on what side you sleep? Make conscious effort to sleep on the left. The earlier you practice sleeping on the left, the better for you. So even if your belly is not showing, even if your bump is not showing, make conscious effort to sleep on the left, so that towards the 2nd trimester, you are now used to sleeping on the left. Okay? Does night sickness mean boy or girl? This is actually another myth I kind of, forgot. So the fact we call it morning sickness doesn't mean it only happens in the morning. No. You can have morning sickness in the night, in the afternoon, in the morning, and most times more pronounced during the 1st trimester. As you get older in your pregnancy, most women will notice that their morning sickness will reduce. It's a kind of a hormonal thing. Up to now, we don't know why women have morning sickness, but we felt it's hormonal changes, hormonal redistribution that happens in pregnancy. But the fact it's called morning sickness doesn't mean it only happens in the morning. That's a myth. Okay, it can happen anytime. Okay, let's continue, guys. Let's see what we have. Let's actually wrap up. We have about 5 more minutes. Okay. Some people believe that the vaginal delivery is somewhat superior. This is another myth I want to demystify. There is no merit in superiority between CS and vaginal delivery. Vaginal delivery is normal delivery. Cesarean section is normal delivery. Both of them are normal deliveries. There is no superiority. Some women will be qualified to go for vaginal delivery. Some women will need elective CS or emergency CS. Now, there is no superiority. Both of them will have some risk factors in cause of delivery, okay? But there is no superiority. The fact you had your baby through the vagina doesn't make you superior to someone that had a baby through the CS. Guess what? Before the advent of modern technology, modern medicine, so many women were not mothers. So many women died during childbirth. So many women were not able to have their babies because they had an option of going for CS, because not all pregnancies can be delivered through the vagina. Some pregnancies will have a lot of challenges if you go through the vagina, like if you're having a breech baby. Your baby ordinarily is supposed to come with your head, but some babies will decide to come with their side or with their buttock. It's called breech. So in that situation, if delivery is difficult, what do? We take the woman into the theater. When you blink, the baby is out. So cesarean section is a blessing. We have to embrace it. It doesn't take your motherhood away from you. It doesn't make you inferior. Vaginal birth doesn't make you superior. What we want is a healthy baby. And how can you have a healthy baby? By attending all your ANC, taking all your medications, making sure you're avoiding all those stuff I mentioned. So there is no superior, there is no inferior method of delivery. Completely nonsense. Okay? Is it good to take alcohol while having fibroid? Generally, personally, if you have to take your alcohol, take it moderately. But now you have fibroid. The question is, what are you going to do about your fibroid? Not whether you're going to take alcohol when you have fibroid. The question is, what type of fibroid do you have? What's the size? What about the symptoms? If your fibroid is located inside your womb and is bigger than 6 cm and is giving you a lot of symptoms, go and remove it. So my worry is not whether you're going to take alcohol. You should know the limit of alcohol you should consume. But regarding your fibroid, the question is, if you want to become pregnant, then deal with your fibroid. But not all fibroid will require surgery. Go to your doctor and let your doctor be the person that will decide the route you will go with your fibroid. But by any means possible, please deal with all fibroids. Okay? All right. What leads to low blood pressure during pregnancy? It can be a lot of things. It can be changes in the whole hemodynamics in pregnancy. So different blood distribution and a couple of things. It can be hormonal. It can be a sign of an abnormality. It can also be from taking some drugs. So any of these things can lead to low blood pressure. And it might be transient or it might just be there. So if you notice, when they measure your blood pressure and it's below 90/50, you have low blood pressure, we need to fix it immediately. Very important. Some women can also be losing blood. When you're losing a lot of blood, you can also have hypotension. So you have to report to your doctor immediately. Okay? All right. If a woman is up to 42 weeks with no sign of labor, is it okay to still go on with the pregnancy? It's not your call anyway. Any real mother, any caring mother, any mother hen out there will know that by the time you get to 42 weeks, you are now considered post-death, post-date. Your pregnancy has graduated. We need to bring that baby out. Now, sometimes some doctors will say, okay, let's give you maybe extra 1 week, because sometimes in calculating your EDD, you might have 1 or 2 weeks discrepancies. But once it's confirmed that you have truly reached 42 weeks, we have to bring your baby out by any means legally and medically possible. You can go for augmented labor. You can go for labor by instrumentation, or we can straight on go and open you up, emergency CS, and deliver your baby. Any baby that comes to 42 weeks is no longer doing anything inside your belly. We need to bring that baby out, okay? All right. Stop complaining about your pregnancy symptoms. You should be happy you are pregnant after long-term BFB, okay? Please speak on this expectation that pregnancy after BFB is filled with happiness. Please be careful and mindful the words you use on any pregnant woman. It doesn't matter if it's after 20 years. It doesn't matter if it's after 3 months. Pregnancies can change people's perspective, people's life, people's mood. People present and people deal with pregnancy differently. Stop telling people not to complain. That complaint might be their way of coping with their pregnancy discomfort and their pregnancy issues. Learn how to use kind words. If you can't help them, then don't talk to them, because women that are pregnant have very sensitive emotions. They cling on anything. So what they are craving for when they are talking to you is simply love. They want support. They want understanding. They want compassion. So if you have a pregnant person in your midst, please don't tell her, oh, you should be happy, you should be doing this. Remember, some of them might be prone to depression. Some of them might have anxiety. Some of them might have other mental health problems. So they are seeking for help. So don't just write them off or dismiss them or discharge their symptoms or tell them you don't know what you're doing. Just like the experience you have in Nigeria, when some women go into labor and when they go to the hospital, some hospital staff, including nurses, they will be calling their names. Some of them might even be beating them and doing stuff. You don't do that. These are the mothers that will bring forth our babies. So you don't do that. It's completely a no-no. So use kind words. Use kind words. It doesn't matter if you've been looking for a baby for 20 years, then suddenly you became pregnant. If you happen to have yourself in that situation, you're having a precious baby. And definitely you probably might be on advanced maternal age. So you should be more careful. But that pregnancy is going to be unique to you. So don't dehumanize, don't shame any pregnant woman because of her complaints. All complaints in pregnancy are genuine. We have to support them, love them the way they are. What causes a baby to be in breech position? Some babies will just love to be in that position. So there is no specific thing that leads to different positions of the baby. There are so many complex processes that go on in the babies, before they will eventually assume a particular position. The likely position your baby will be in before delivery would have started at 36 weeks. So if you go for your ANC and they discover that your baby is currently cephalic, that's head, then you're likely going to have a baby that will present with head. But if you go at 36, 37 weeks and your baby is breech, go home and start getting ready for CS, because likely that baby is going to be delivered. But there are some practices. We can try a couple of other methods to see if we can still deliver breech. So some providers can still deliver the breech through the vagina. Some might need what we call external cephalic version. But please, don't worry about how your baby is going to be born. So long as you have a good doctor, you have a good facility, you have backup facility. Like if you're going to have your baby, make sure the hospital you have is a tertiary center. So what I mean by tertiary center, you should have a functional theater, standby theater, because some women can go into labor, they can have delayed labor, they can have obstructed labor, they can have problems that will warrant us to go to the theater immediately. You don't want to have a situation where you're delivering in your village, then you have a need to go to the hospital, then you want to go to the hospital and you get caught up in the traffic. You have to have the best. When you are pregnant, register with the best hospital. Don't compromise standard. Don't compromise money. Go for the best doctor in your community. If you're in Lagos, go to the best doctor in Lagos. Go to the best hospital in Lagos. How you treat your pregnancy will determine how healthy your pregnancy will be. Very, very important. Okay? All right. So do I have any other question? Okay. What gestational diabetes, it's more like a predisposing factor when you have a couple of unhealthy lifestyle. So you heard me mentioning about your BMI, what you eat, your stress level. If you adopt a healthy lifestyle, you might likely avoid gestational diabetes. But the good thing about gestational diabetes, once your pregnancy is done, your body will return back to normal. In some cases, the same thing is also applicable to pregnancy-induced hypertension. It means that when you're pregnant, you will develop hypertension, but when you deliver the baby, you will come back to normal. The same thing happens to women that might have gestational diabetes mellitus. Once your baby is delivered, then your blood level will come back to normal. All right? Thank you so much for coming for today's clinic. I love the questions. Now, remember, if you want to go to our exclusive YouTube community, click on the link in the description box, join, select your option. We have 3 options. Once you join, YouTube is going to inform me, then I will start creating exclusive content for these chosen community. Subscribe, share this video, especially to all pregnant women. Remember, the journey to motherhood is just starting. Motherhood beckons. You will blink and you're a mother. So be careful. Everything you do from waking up to sleeping in pregnancy is important, especially your lifestyle, what you eat, where you go to, your ANC. Be careful. We don't want to lose any of our babies, okay? Thank you for coming. I appreciate you guys. My next clinic will be on Tuesday. So I'll see you on Tuesday, 6 p.m. Eastern Time, US, 11 p.m. Nigeria. Until I see you again, God bless you and thank you for coming. Bye-bye for now.